Meet the Abdullahi family. They live in a village and have 3 children. Abu is 13. Aishatu is 10. And Aliyu is 4. Abu's parents, Kabiru and Fatima, work very hard to keep their children safe and healthy. But bad things can happen. Abu's neighbor, Hausa died when he was only 3 years old from an illness called polio. Polio is a serious disease that affects children under 5 years old. Polio spreads very easily by drinking dirty water or not washing your hands after using the toilet. There are only 3 countries left in the world that still have polio: Nigeria, Afghanistan, and Pakistan. Polio can cause disability or death, but polio can be prevented. Aliyu and Aishatu love playing outside. One morning, Abu noticed that Aliyu came running in for food without washing his hands. Aliyu's hands were very dirty, but he was eating with them. He remembered Hausa doing the same thing. Abu decided he had to do something to make sure people wash their hands.
After Husamatu's death, Abu wanted to know more about polio and how to protect his family. He spoke with his local volunteer community mobilizer, VCM, Kadeza, and learned a lot about polio. This is the story about how Abu taught his family about polio and helped the children of his whole village stay healthy. Kadeza told Abu that when people don't wash their hands before cooking or eating or after going to the toilet, they can get very sick. Polio is spread like this. It is not an evil spirit that enters the body, but it enters the body through the mouth from dirty hands. It's also spread when the streets, houses, and toilets are dirty, when people drink unclean water, and when sanitation is bad. Kadeza explained that children infected with the polio virus may have a fever, feel tired and weak, have a headache, vomit, and be stiff in the neck. Their arms and legs may become very weak so that they can't stand or use their arms. Abu remembered that Husamatu had these symptoms. Abu has also seen a polio survivor walking in his village with crutches.
There is no cure for polio, but through a vaccine, which is used in many countries, polio can be prevented. Only through proper immunizations that must be given multiple times can children stay safe from polio. Khadija told Abu that not all parents immunize their children. Sometimes parents forget how important vaccination is or refuse to let polio health teams in when they visit their homes and villages. On the walk home from school, Abu thought very carefully about what Khadija told him. As a big brother, his duty was to keep Aishatu and Aliyu and other children in the community safe from polio and other diseases. He decided it was an important responsibility to make sure everyone in his village understood what needed to be done to protect the children's lives. When he got home, Abu asked his parents if Aishatu and Aliyu had been immunized against polio. He told his parents that Aliyu often forgets to wash his hands with soap and water after going to the toilet and before eating food. Abu reminded his parents that Hausa used to do the same thing. He reminded everyone that not washing hands can be very dangerous. Abu told his parents that he was worried about other young children in the village. He told them that Khadija told him that people in the village don't take polio immunization seriously enough. Kabiru, Abu's father, decided to call a meeting outside their house so that the village elders could hear what Khadija had to say.
Abu told his parents that he was very worried about other children in the village. He told them that Kadeza told him that people in the village don't take polio immunization seriously enough. Kabiru Abdullahi, Abu's father, decided to call a meeting outside their house so that the village elders could hear what Kadeza had to say. Volunteer community mobilizer Kadeza told the village that polio was a very dangerous disease, but that it can be prevented by giving children 2 drops of the polio vaccine, by keeping your environment and home clean, always washing your hands before and after using the toilet, and before eating. Parents, communities, traditional leaders, religious leaders, and health workers must work together to make sure children are safe from preventable diseases like polio. The polio vaccination is the only way to protect babies and children from polio. Immunization is free for every child, and community vaccinators go house to house to vaccinate all children under 5. Parents should allow children to get the polio vaccination called OPV every time the polio teams visit their homes or come to their village or at the nearest health facility.
Husbands should instruct their wives to make sure all their young children are vaccinated, even in their absence. Polio can be stopped if we follow the rule: 2 drops every child, every time. All caregivers must remember the vaccination schedule: 1st dose at birth, 2nd dose at 6 weeks of age, 3rd dose at 10 weeks of age, 4th dose at 14 weeks, and 5th and last dose at 9 months.
Kadeza took Abu's father to the local mosque imam to get his opinion. Malam told them that it is everyone's responsibility to make sure our homes and kitchens are safe. Dirty neighborhoods and streets, open sewage, and dirty water bring illness like malaria, cholera, and polio. All children like Aliyu must be taught to always wash their hands. Kadeza said that drinking water must always be safe and clean. Dirty water brings diarrhea and diseases. She explained that everyone must boil water for 5 minutes, then filter or sieve it through a clean cloth and store it in a clean jug or bucket. Remember to keep the water covered so no dirt can get into it.
We must all take responsibility for our health and safety like Abu did. With his help, and with the support and advice of Malam and community mobilizers like Adija, the villagers cleaned their streets and homes and made sure all their children got vaccinated and were safe from disease. All children like Aishatu and Aliyu deserve better health. Polio can be stopped. Remember, 2 drops every child, every time.